is a functional monocular patient. You can see the axial length is quite small, and so the required power is out of range for this lens, for this lens, for this lens, but is available for this lens. You can see that the patient also has high amount of astigmatism, so I'm actually intending on placing a toric lens. And for most of the toric lenses, they're also going to be out of range. So for example, the Invista toric here, you can see it's out of range. But for the ZCT and the ZCU, it is available. And if we go to other lenses here, for the Panoptix toric, it is also available. Now, this patient is also 93 and has pseudoexfoliation. The intended plan is to place a toric lens, but when you're discussing about toric lenses in these more challenging cases, you also want to tell the patient there's a possibility that a toric lens may not be possible, and so to always have a backup lens. And so the backup lens here would typically be a 3-piece lens. Now, again, notice how these two 3-piece lenses are out of range, but keep in mind that when you're putting a 3-piece lens, you're typically, depending on the absolute power, you're typically subtracting by 1 diopter. And so although this lens is out of range, it's recommending a 30.5, but if you were to subtract 1 diopter, you'd be at 29.5. So you still have this lens in stock. Whereas this lens here, if you were to subtract 1 diopter, again, this would be 31. You would still place a 30 diopter lens in the sulcus, and so it's just important that you have the appropriate intended monofocal IOL or toric IOL, I should say, which is this case here, and that your backup lenses are within range. And in here, at face value, it looks like they're not in range, but if you're placing a sulcus IOL, you're subtracting 1 diopter, and so that should be able to give you the intended power that you need. I hope you found this to be useful, and thanks for watching.